Multicenter randomized trial of endoscopic papillary large balloon dilation without sphincterotomy versus endoscopic sphincterotomy for removal of bile duct stones. Marvelous trial. Introduction. Endoscopic sphincterotomy, EST, is the current standard for the treatment of common bile duct (CBD) stones. Endoscopic papillary balloon dilation, EPLBD, first introduced by Starretts et al. In 1983, is a possible alternative, but it is reportedly associated with an increase in post-endoscopic retrograde cholangiopancreatography, ERCP, pancreatitis, PEP, and is now performed only in selected cases with altered anatomy or coagulopathy. While late biliary events are less common after EPLBD because it preserves the function of the sphincter of Oddi, it is also associated with the use of lithotripsy, especially in patients with large CBD stones. Endoscopic papillary large balloon dilation, EPLBD, has been increasingly used to manage those with large CBD stones. While EPLBD is often preceded by EST, EPLBD without EST reportedly provides comparable outcomes. However, few data are available on a comparison between EPLBD without EST and EST alone. If EST can be omitted prior to EPLBD, it would be favorable in terms of the risk of bleeding as well as cost effectiveness. Therefore, we conducted this multicenter randomized controlled trial, RCT, of EPLBD without EST and EST for the endoscopic treatment of large CBD stones. Background: EPLBD has been increasingly used for the management of large CBD stones. Although EPLBD is often preceded by EST, EPLBD alone without EST has been increasingly reported as an alternative to EST for large CBD stones. Methods. This multicenter randomized trial was conducted at 19 Japanese institutions to compare the efficacy and safety of EPLBD alone versus EST for the removal of large, 10 mm or greater, CBD stones. The primary endpoint was complete stone removal in a single session. The secondary endpoints included overall complete stone removal, lithotripsy use, procedure time, adverse events, and cost. Results: 171 patients with large CBD stones were included in the analysis. The rate of single-session complete stone removal was significantly higher in the EPLBD alone group than in the EST group, 90.7% versus 78.8%, p equals 0.04. Lithotripsy use was significantly less frequent in the EPLBD group than in the EST group, 30.2% versus 48.2%, p equals 0.02. The rates of early adverse events were comparable between the two groups. Rates of overall adverse events were 9.3% versus 9.4%, and of pancreatitis were 4.7% versus 5.9% in the EPLBD and EST groups, respectively. The procedure costs were $1,442 versus $1,661 in the EPLBD and EST groups, respectively. P equals 0.12. Conclusion: EPLBD without EST for the endoscopic treatment of large CBD stones achieved a significantly higher rate of complete stone removal in a single session compared with EST without increasing adverse events.